Welcome back to another episode of the ideaHUB Innovators Podcast. I'm your host, Letitia Vickery. On this episode, we welcome Vanessa Best, an award-winning entrepreneur and the founder and CEO of Precision Healthcare Consultants. With a track record of expanding her firm's impact across 39 states, 11 countries, and 3 continents, Vanessa is a leader in healthcare quality, improvement, regulatory compliance, and equitable access. As a trusted federal government vendor, she's secured major contracts with CMS and the CDC. A champion for mentorship and women entrepreneurs, she continues to break barriers and drive healthcare innovation. Stay tuned as we dive into her journey and insights. Welcome back to another episode of the podcast. With me today is
Vanessa Best, CEO and founder of Precision Healthcare Consultants.
Vanessa. I am so honored to have you on the podcast today. I have had the pleasure of watching your business, watching you do the work that you do for the last several years. And now we get to jump in and share your story with our audience.
Well, that sounds great.
Let's start from the beginning, why don't we? Tell us about the inception of your journey as an entrepreneur.
Sure. So I found myself having my first child and working at top hospitals across New York State. And I wanted that work-life balance. So there was a gentleman, no disrespect to men here, but the gentleman in my department at the hospital had a consulting business on the side. And I said to myself, if he could do it, I could do it. So I approached one of the head doctors at this huge hospital that was leaving to start their private practice. And I said, you know what? You're leaving to start your practice. I'm leaving to start a consultancy business. You need patients to trust you. I need a physician to trust me. And that was my first client.
Wow. So that takes a huge amount of courage to be able to say, this is how I'm going to do it.
Right.
Where does your courage come from?
Oh, I think from my mom. You know, my mother, she passed away several years ago, but just a strong, determined, spiritual person, and just always taught me the value of hard work and then also giving back. So I have to really attribute a lot of that to my mom.
And so for many entrepreneurs in the beginning stages of their journey, they're digging deep, they're having that courage to embrace the risk that starting a new business comes with, all of the uncertainty. Can you talk about some of the trials that your business faced at the beginning and how you overcame those trials?
Sure. So what happened, a trial which really became a benefit is we started growing. So from working with that initial physician, we started just doing medical billing for the doctor. And then that grew to really more consulting. Then it grew to doing an analysis and doing forecasts. And that doctor was so happy, as most physicians do, they started telling their colleagues. So we rapidly started getting doctors, basically not just in New York, but from around the country that wanted our services. So that growth, which was a challenge, really made me see the need to delegate and to really bring on others to the company. So that, I would say, was a big challenge that we had. A big challenge, but a good one.
So there are so many lessons that you learn along the way, especially when expanding your business, right? And I think first and foremost, you learn the importance of taking care of your clients and how important every interaction with each client becomes. What are some of the tips that you would give to up-and-coming entrepreneurs that would enable them to go from one important client to several?
So I think on that entrepreneurial journey, regardless of how you expand and how your capacity builds, it's important for each client to feel that they are your only client, right? So being intentional, putting processes in place. When there are problems that you're alerted to them, also being very proactive with your clients. Something as simple as doing a survey and really asking them how the interaction is going. What are areas that you can improve? I think is very, very important. And when you set those policies and procedures in place from the beginning, as you grow and your capacity builds, those systems will continue to work really well.
Oh, that's wonderful. That's wonderful. So, ensuring that you follow through, right?
Yes.
Follow through on your promises, follow through on the systems that you've put in place,
Right.
follow through on understanding that not everything might be perfect and there's a lot that you can learn from those client interactions.
Right.
What wonderful advice.
Thank you.
Now, building a company, growing staff, right, comes with its own challenges.
Yes.
Right. And so, how do you manage your staff relations? We know that every industry has issues with employee turnover, finding good talent, finding the right talent, and finding talent that fits with the culture of your organization. What are some of the guidance? What's some of the guidance you would share?
Well, one of the things that we found, it's better to keep a good employee than to go out and find a brand new one. So we build a very close culture at Precision Healthcare. Um, Even during the pandemic, things like Zoom dinners, Zoom lunches, and even now, as our company has grown, where we have employees not just within the US, but even abroad, having those connections is something that's very, very important. We also find that when you have a good culture, people, members of your organization, will refer others. So a lot of our employees have come from referrals as well. And even from clients, it's just interesting when you develop a good culture, you have a good brand, you really attract really, really good talent.
And so, what are some of the key pieces of Precision Healthcare's culture?
Very, very good question. Integrity, that's really, really important. Teamwork, very, very important. A lot of our employees do volunteering. We do volunteering as a company. And then individually, most of our employees are volunteering. They're giving back to their individual communities. And I think that is just wonderful about our culture and something that keeps us really moving forward.
Oh, that is wonderful. So, just not only developing care for the client, but also care for the employee, right?
Yes.
Treating the employee as a precision healthcare family,
That's right.
right? And that's wonderful because it really does that type of behavior, that type of intentionality on the part of a business owner really does lead to developing an amazing team.
Yes.
Now, let's get to you as the owner, right? Growing a business will also demand that you grow, right? So growing a business doesn't just demand that you pour into the business, but also demands that you pour into you as the owner, as the leader, as the visionary. And so, what were some of the ways that your business has stretched you personally? And how have you responded to meet those demands of the business?
That is a good question because having an operation with one physician that's in New York till now managing an operation with 3 locations in the US, a location in Africa, federal contracts, state contracts, private contracts with corporations. Yeah, I've been stretched. But I would say some of the things that have helped me have been amazing incubator programs that's really helped me to develop as a leader. And that's also brought me into an ecosystem with other leaders. One, for example, I'll talk about the Ascend program at Hofstra. So I had the privilege and the honor of really being a mentor for some early stage businesses as part of Hofstra Ascend, sponsored by Chase. But the other side of that is I was one of the only, I think still the only person that was a mentor in the program, and then also a recipient. Because Chase, through Ascend, has a national program for businesses that may be a little more mature or a little further along in their journey. And that just connected me to leaders like Ernst and Young and RSM, where there's tools and there's programs that I was able to participate at Northwestern University on really becoming a better leader. So those incubator programs, another one, EY, Ernst and Young has a Entrepreneurs Access Network, and just the resources. And it's interesting because both of these programs don't necessarily provide businesses with contracts. It's not transactional, but it's really capacity building for the company. And then for entrepreneurs like myself, CEOs that are leading a company. So those are things that have really helped me develop my skills as a leader.
What an amazing opportunity to have been able to share your impact, your journey, your experience with up and coming Ascend participants, but then also to be able to receive from the national program as a business owner yourself. And I think it's wonderful that you have been able to not just make impact in our domestic markets here in the US, but also expand your services to other countries outside of the US who need this type of quality healthcare, right? And so can you tell us about that? Tell us about that journey from being a domestic company to now becoming an international company.
So I have to say it's with a lot of assistance. So many folks do not know, but New York State, Empire State Development, there's a whole trade department, and their goal is to really help businesses that want to expand globally. There's grants available, there's counseling available. We were able to participate and be a grant recipient to actually participate in a trade mission to Africa, which was absolutely amazing, and participate in one of the largest healthcare trade shows in the continent. So that was really great. A lot of our journey began with the federal government. During the pandemic, the CDC had a need for doing monitoring initially remotely. So that's clinical monitoring based on research trials that are done across the continent. And during the pandemic, there was no protocol, there was no playbook to do that. So we were tasked to develop a remote monitoring and then hybrid monitoring system across the continent in Africa as well as Asia. So that's gave us our entry point. And then with the assistance from New York State, that's helped us to really grow that business. So really glad to have an office there, have employees that are working, doing meaningful work, both for the federal government as well as in the pharmaceutical arena.
That's wonderful. Now, you speak so eloquently about your journey, right? But I know that it has taken a lot of blood, sweat, and tears on the part of the visionary for this company. Um, can you help the audience get to know a little bit more about the services that the company provides? And then we'll dig in a little bit into how you are able to masterfully set up such expansive operations.
Oh, thank you so much for that. So I would say there's primarily four pillars where we provide assistance. One is with clinical research monitoring, and that's working with pharmaceutical companies or the U.S. government on supporting clinical trials. And that support of clinical trials goes down to going into healthcare deserts. So there's some deserts across our country as well as abroad where folks do not have access. And those are the people that need help. And those are the folks that need to be involved in research and clinical trials. So by means of our medical director, our principal investigators, we identify those deserts across the country, and then we bring them to the government or to pharmaceuticals so they can be included with the research that's done. Another impactful thing that we do is provide services for people with disabilities. There was actually a law enacted back in 2019 that all federal agencies were required not to discriminate against people with disabilities, but provide them with activities of daily living so that they could properly do their job. So we're able to support the government across multiple agencies with doing that work. We recently have begun working with the state of New Mexico as well with doing that good work. So those are two, our pharmaceutical and clinical monitoring, our PAS services, personal assistance services. The other thing is utilization reviews. So we have a team of nurses that work across various outlets reviewing patients' charts, ensuring that the care that they receive was adequate, ensuring that there's no indications of fraud and abuse within those records. So that's the third area. And then the fourth area is revenue cycle management. So we started out, as I mentioned, doing medical billing for one doctor, but now we work with healthcare systems. We work with government agencies with actually doing medical billing in several hospitals across the state as well.
So you've been able to develop these tangential services connected to sort of that main core of developing and providing quality healthcare services.
Yes.
Now, so many business owners are at the cusp of being able to say, is it time for me to extend myself into a new market, into a new service? When do you know it's the right time? How do you say yes to bringing on a new service, expanding the scope of your work for the company? And how do you do so in a way that does not harm the company?
Very, very good question. And there's no precise answer. I would say a lot of it depends on the industry, the needs of the industry, and where we are in the marketplace. So, for example, during the pandemic, another thing that we did, an expansion of our business that we didn't stick with, but there was a need for PPE, for personal protective equipment, things such as masks and gloves. So since that was a need, and some of our current suppliers that we were doing other work for said that that was a need, so then we went down that road and we solved that need. So it goes back to what we were saying a little earlier, developing also a good relationship with your customers. Because when you have that good relationship with your customers, you may be providing one service, and they, because of the trust that is built, may ask you, is there something else? Is there an ancillary service that you can add? Another good thing that we have done is also partner with other entrepreneurs. So if a client or the industry dictates a need and maybe it's related, so then we'll partner with someone else. And that way we continue to grow the economy of our community as well.
That's wonderful. So in doing this, I know that you have developed resources, tips, guides. Let's get into some of those, right? In my head, you are the resource queen. I promise you, every time I watch you present to an audience of up and coming business owners, established business owners, I just kind of sit back with my notebook.
You're too kind.
And when you're done, I'm like, mic drop.
Oh, thank you.
And that's truth, because there's never been a moment where you haven't brought something that is just, yes, we need this information, right? It shows your level of preparedness, your level of taking every opportunity to impact other business owners seriously.
Thank you.
And I've been able to watch your presentations for the last several years, right? And so that says a lot. Now, because of that, this is why I call you the resource queen in my head. What are some of those resources that you would want to share with some of the listeners?
Oh boy, how much time do we have? Well, there's a few organizations that I would definitely recommend. One being the Small Business Administration. The Small Business Administration, their goal is to help businesses grow from the point of inception to the point of mature businesses that are looking to purchase real estate. So I would definitely leverage the SBA. And through the SBA, they have several other resource partners. So one I would mention are the women business centers. So for women business owners, look at those. The other would be the small business development centers. Those are located about. There was another one called, it's now called Apex, that helps you with developing contract skills or responding to an RFP. The other thing I would recommend for those that are in the transportation, the Department of Transportation also has resource centers. So for anyone that's doing anything related to that, that would be a good resource. And then I would say apply for programs such as Ascend that's in Hofstra. I would say apply to the Goldman Sachs 10,000 Small Business. Excellent, excellent program. I would say apply to the EY Entrepreneurs Access Network. All of these are networks and resources to help businesses, if they're just at the point of concept, to really develop a business plan. There's research that some of the SBA business partners will do. If you say, I want to, let me think of something not related to me. If you wanted to sell drones, for example, the SBDC, Small Business Development Center, can do marketing research. And they can let you know across the federal government, across local government, across industry, these are companies that may potentially be interested. And we utilize them at the beginning of our journey when our clients were mainly physicians. And we asked, give us the names of all of the physicians in Nassau County and Queens that had X amount in revenue, that also had good credit.
You must be specific.
Yes. So those are just some that I would just off the top say could be very, very helpful. Oh, one other one, very, very important. The Minority Business Development Agency, amazing untapped market. They are the SBA for minority-owned businesses, another government agency that will help businesses to grow, to scale, to have resources. And one of the ways that they helped us is we're in healthcare. They introduced us to healthcare in construction. This is the Manhattan Center down on Wall Street, and that's been amazing for us as well. So just a few nuggets that hopefully can be helpful.
And so y'all see why I call her the resource queen, because this is just a drop in the bucket.
Thank you.
So there are two questions I want to ask.
Yes.
That's relate to the resources you just shared. The first one will be about how do the members of our audience take advantage of these resources in the best way? Because the question is, wow, there's so many resources. I have so little time. Right? So there's that. And then also, you've been a part of procurement processes, right? And so procurement is another untapped space for our up-and-coming entrepreneurs who don't exactly know how to navigate that side of pursuing different revenue streams. So can we talk a little bit about those two things?
Sure. So there are tons of resources. What I would recommend, pick one a month, because it's important to take time, and we've all heard this, to work on your business and not in it. So we have to allow ourselves time for business development, and it's called business development, capture development, whatever term we want to use. So I would suggest, okay, this month is SBA, next month is Women Business Center. And the best way to work with these agencies is to go on the website and schedule an appointment. Or how about this? I'm getting into Chat GPT now. So our business, our company has a strong initiative to really better our processes through AI. Okay. So I would go into AI and I would just prompt it and say, this is my business. How can the SBA help me? How can the MBDA, Minority Business Development Agency, help me? And then you have like a little blueprint. So then when you go to the agency and you meet with a counselor, you already have a platform or somewhat of a guideline in terms of where you can start.
Right. Okay.
And you asked another question.
I did. It was about the procurement.
Procurement. That's a big one. That's a very, very big one. A lot of the resource partners, especially Apex and the Small Business Development Center, they can help. They all have training sessions. The SBA has training sessions on procurement as well. What I would recommend is the importance of certification. So there's certification through the federal government, through New York State, through New York City, as women-owned, as disability-owned, as veteran-owned, through NMSDC. So apply for all of them, because what I like to say is, in order to be successful with procurement, you have to follow the money. So if the money's coming from the federal government, then you need a federal certification. If it's coming from New York State, then you need that. If it's coming from a corporate, then you need a WeBank or NMSDC. So that would be my tip on procurement. And don't be afraid to respond to what's called RFIs, or requests for information, or sources sought, because that's your opportunity to let the procurement people know we're out here, we're interested, and sometimes you can even craft what the RFP, the request for proposal, will look like. So don't wait for the actual proposal. Be really eager to respond to sources sought, and then develop a plan. Each month, we're going to send out maybe one to start, and then you build it to 2, and then to 3, and then to 4. And then your win rate, or your ratio of winning compared to what you submit, will eventually get higher.
So timing is key.
Yes.
Timing is key. And what I really hear you saying is, don't try to do everything all at once.
Correct.
Understand that you come up with a strategic plan that will take time, right? So not to overwhelm yourself with trying to be here, there, and everywhere is an important lesson. Patience. Patience is important, right? So I want to transition into talking specifically about your industry, the healthcare industry. You've been in this industry now for how long?
I don't want to give out my age.
Long
Over 30 years. Over 30, and we'll stop there.
But I asked that question, and forgive me if it was, but I asked that question because I want the audience to understand the level and depth of your expertise. You've been in this healthcare industry through many different transitions, right? And have been able to maintain a strong business, a business that has grown, and a business that has been able to pivot into multiple ancillary services, service areas. Now, with that expertise, I believe, comes the ability to be able to speak to the needs of the industry as it goes forward, as it continues to evolve, especially given the current state of our economy, our politics, our government, and all of the uncertainty that presents itself in stages of transition. So share some of your thoughts on that.
So I had an opportunity to be a part of a Shark Tank. And this is another organization for anyone in healthcare, pharma, Diversity Alliance for Science, amazing organization. So I had the opportunity to pitch as a Shark Tank competition. And I started by telling the story of my mom, who had brain cancer. And although we lived in a middle-class neighborhood in Queens, had good insurance, my mother could not get the medication that she needed for her brain cancer in our neighborhood. The pharmacies just didn't carry it. So that just told me that this whole health equity, it's real. Like for me, it's not a punchline. It's something that I lived and, unfortunately lost my mom. So what I see is a continual need for access to care for everyone. And I mentioned 30 years, okay, 40 years. I've been in this industry. I put it out there. And there have been some advancements, but there's still such a long way to go. And I'm not talking about internationally. I'm talking about right here in our country, in our state, in our community. The access to care just isn't there. One of the big challenges that the government has even recognized, and I mentioned this statistic, 30% of Black people in this country will die of some type of heart disease. 30%. That's the real number. And although Black people make up 14% of the population, less than 7% are represented in clinical trials. So that's a problem. So you have this large number of people dying because of a disease, but they're not included in the clinical trials. So one of the things that the FDA, Federal Drug Administration, they now have a mandated diversity plan. And what they basically say to pharmaceuticals, we're not going to approve this drug unless you show that there's an inclusiveness. So I think that that's a really big challenge, and many pharmaceutical companies are facing that challenge because traditionally what has happened with people of color, there's not a trust, right? With the Tuskegee and all of those things, there's not a trust. So one of the things that we're trying to do to solve that problem is to bridge the gap, right? To try to build the trust within our community. So there will be greater participation in clinical trials, especially in those healthcare deserts that really need it the most. So that's the big thing that I think is happening within the industry right now with healthcare.
Yeah. Do we dare comment on some of the uncertainty for companies who are still committed to diversity, but there's such great pushback around how these companies pursue diversity?
That is a very difficult, because DEI as it is out there has to do with procuring people or positions because of that. But when it comes to healthcare, is it really DEI, or is it statistically certain groups don't have access or are not represented? That's a really, really difficult one. That's a really, really difficult one.
Yeah. And I think to that point, I think the challenge ahead of us, and when I say us, I mean people like yourself working in this space, people like me, institutes like the Institute for Innovation and Entrepreneurship and the work that they do in the local community. The challenge will be finding new and creative ways of still bridging the gap for diverse people in the communities that tend to get overlooked where it concerns certain resources, especially in this age of fair when it comes to diversity, equity, and inclusion, right? As a business scholar, there's a deep understanding in me where it concerns companies having to, quote unquote, follow the money. right? And I'll pause there, right?
Sure.
Because we can all understand that from a company perspective. But on the other side of that is a company's obligation and responsibility to protect society, to push society forward in the best ways, to make certain that it's serving their local and international communities in the most equitable ways. Right. And so I think the call for people like ourselves who are deeply invested in this kind of work, no matter what industry you're in, is to help these companies find other ways and creative ways of doing so. Right. We're going to need new ways of doing it.
Right. So one of the approaches that we have taken so that we're equitable is looking at these healthcare deserts using census tract data, right? So the census tract data could show, is there a neighborhood with single parent families? Or is there a neighborhood where the percentage of high school graduates is lower? So we found by using that data, it puts us in the communities that we need to be in. And that way, it's not about race or ethnicity. It's about the census shows that these are areas that a gap needs to be made. So that's been an approach that we have.
Wonderful. And so that is the call. That's the challenge, right? This information is out there. The onus is on us.
Yes.
And the companies that are doing this kind of work, like Precision Healthcare.
Thank you.
To find the data, right? And to use the data to empower our people and empower the solutions we bring to the table with the data.
Yes.
Right? And so let's talk about your impact. What kind of impact have you been able to have? Do you want to keep having as you go forward and as you continue to do the work?
The impact on communities, first and foremost. And then one of the things I'm really, really proud of is we have a mentorship program. And our mentorship program, part of it is working with young folks from what we would call underserved areas, from hub zones, or from HBCUs. And I am just so proud that some of those young people have gone on to have amazing, amazing careers on their own. And then even more importantly, we've been able to then hire some of them, and they're doing really great. So I would say that's one impact that I'm really, really proud of, the fact that we can reach and help the younger generation to really learn about data analytics and how it relates to social determinants of health, and then they can go on and do great work after that.
Amazing. And that's a seed that just keeps growing.
Yes.
Right? And personally, what kind of impact do you hope to have? You started by telling us that the seed of your company was planted by the experience of your mother. So personally, what kind of impact do you want to leave when all is said and done? What do you want your legacy to be?
That Precision was able to help lives, both those that we serve. I think to date it's like a little over 1 million, as well as every employee that became a part of our family, that we can contribute to their happiness in their life.
That's wonderful. That's a big legacy. And so if you'll take a moment and remind the audience of the type of work that Precision does, and who are you looking to partner with?
Oh, great. Well, thank you for that. So Precision Healthcare Consultants is a healthcare equity firm, and it is important for us to provide access to care, to facilitate pharmaceutical companies and the government with their diversity plans, ensuring that everyone is represented in clinical trials, for construction sites, providing safety, on-site medics, utilization reviews. And who do we want to partner with? Wow. We want to continue to partner with pharmaceutical companies. We want to continue supporting government agencies where we can make an impact. Always happy to continue to support the state of New York, working with the Department of Health and any other hospital systems across the nation. And last but not least, also very interested in collaborating with other entrepreneurs, looking for ways where we can team together and really look to them to source some of our needs.
That's wonderful, wonderful, wonderful. And how can people find you, Vanessa?
Sure. So our website is www.precisionhcc.com. Also, we're on LinkedIn, Precision Healthcare, or they can contact me directly on LinkedIn, Vanessa Best.
Wonderful. And you are the best.
Thank you so much.
So, Vanessa, thank you for joining us on the podcast. It was a wonderful conversation. And I know that the listeners took so many gems away. And you are going to have people contacting you to hear and learn more about those resources, those amazing resources. I had a wonderful time getting to know you a little bit better today.
Well, thank you so much. And thank you for the great work that you're doing. This was wonderful.
Thank you, Vanessa.
All righty.
Stay tuned. See you on the next episode of the podcast.